Simpson with Simpson Dental Associates joins us now. If you have a question for Dr. Simpson, our number is 1-877-924-7888. How are you today, sir?
I'm doing great, and I want to thank our listeners. I tell you, what I'm really seeing is a lot of people addressing their dental health needs. It seems that people realize that in order to have good general health, they have to have good oral health. And I see so many people coming in the office, trying to take care of problems, and I'm really encouraged by that.
Why do people delay treatment, do you think?
Well, I think a lot of people think they're going to save money, but it's just like anything else in life. The longer you put it off, you're going to pay one way or the other, either in more money or in dentistry. A lot of times it's less function. If you lose all your teeth and you have to wear dentures, you're losing so much function, your ability to chew and eat your food properly. So that's one of the big things I see. And the other one is they're embarrassed. They think that they've got a really bad situation and it's going to be the worst you've ever seen. Trust me,
I've seen it all.
I've seen it all in 35 years, and we're there to help you, the dentists are, and don't be embarrassed. We're happy to take care of you.
All right, let's get to our first caller. Jennifer is on the line. Hi, Jennifer.
Hi.
Hi, Jennifer.
Hi.
What can we do for you today, sweetie?
Couple of questions.
Okay.
Are veneers and implants, are those the same thing?
No, they're completely different. A veneer is a thin layer of ceramic that covers an existing tooth. And the existing tooth needs to be in pretty good shape in order for it to have a veneer. Otherwise, it may need to have a crown. So generally, we use veneers to improve the color, the shape of a tooth. An implant is when you're missing a tooth and you need to have that tooth replaced. That is the most efficient way, and it's the standard of care to use a dental implant because, number one, it doesn't attach to other teeth and it helps support the bone. So two different things, but both very useful in dentistry, and we do a lot of those because there's a lot of demand for them.
That's a good question, Jennifer. Thank you. Our next caller is Christy. Hi, Christy. What's your question?
Yes, I just had a quick question about, I was in a domestic violence, and a lot of my teeth got knocked out.
I understand. I'm sorry to hear that.
I had to go and have some of them removed, so I only have like 18.
Okay.
But I do floss and brush the teeth that I have.
Great idea.
But the dentist that I had went to get the referral to get my teeth removed had told me that I don't have to have dentures or partials to be able to eat, but I find that I can't eat anything because it's too hard because I'm going on the gums.
Well, and the other thing is that if you don't have a full complement of teeth, the teeth are going to move and drift, and your bite will collapse over time. So it's very important to get those teeth replaced. I would suggest that, perhaps the dentist hasn't been in that situation themselves where they're missing teeth, and see how difficult it is. Our next caller is David.
Yes, Dr. Simpson. I've got like 4 teeth that need to be done. I need my other teeth pulled. But what do you suggest for me to do?
Well, generally the best thing to do is that if you have 4 teeth left, if there's any way to save those teeth and build off of those, that might be a situation that you could consider. The others, if those teeth are not savable, what we generally like to do is take the last teeth out, place the implants, and oftentimes we can go ahead and attach the permanent teeth to it that same day. So it's a matter of getting a good plan together, and that's what I suggest. When patients come to my office, what I try to do is say, here's the best thing, here's a middle of the road thing, and here's kind of the least thing that you could do. I don't ever presume somebody's budget, and I always want to try to give them the opportunity to have the best care that's available to them. And so get some options and figure out which one you think is best. And I always ask the dentist, what I would ask them is, well, which one would you have? And that's always a good solution. They'll tell you whether they would like that for themselves or not.
Yeah, that's a good point. David, thank you for the call. One quick question. We're talking about veneers and the other procedure, implants.
Right.
Which do you see more often? What's more common?
With the type of dentistry that we do in our office, we generally see a lot of the cases that are, maybe people that have lost a lot of teeth. We do a lot of veneers. Last time I figured I've done over 40,000 of those. That's a huge number.
That's a lot.
But implants are a very, very common situation now. We've got a lot of people in West Virginia that have lost teeth and they need replacements, so implants are a great way to go. And I suggest, if you can, to call our office, and we'll have another implant seminar coming up. That number is 304-342-6162. We haven't set the date yet for March, but call the office and they'll be getting a date. So come and learn more about them. It's a great way to replace your missing teeth.
I know, and your office has those implant seminars quite often too, don't they?
We do, yes. Yeah. We have them about once a month is what we try to do.
It's a great service. All right. Thank you, Dr. Simpson.
Thanks.
Stay tuned.